Hey y'all, and welcome to our Pecha Kucha on heart failure. We will be attempting to broaden your understanding on the topic, signs, symptoms, and treatments through this exciting new format. So without any further ado, let's lub-dub on along. It's a little difficult to define heart failure, but it is generally described as the signs and symptoms of heart failure, along with objective evidence of abnormal ventricular function. And if that sounds a little complicated, basically a positive investigation result in response to a complaint concerning the heart. When one suspects heart failure, there are several investigations to assist with the diagnosis. These include electrocardiogram, brain natriuretic protein or BNP levels, a chest X-ray, and a complete blood count, including differential, to identify any secondary causes. Heart failure can have a variety of causes, but most commonly originates due to an ST-elevated myocardial infarction or resistant or untreated hypertension. Both of these conditions place additional strain on the heart muscle, causing it to thicken. Some causes, such as acute myocardial infarction, acute valvular incompetence, interventricular septal rupture, pulmonary embolism, and cardiac tamponade, require immediate surgical attention and can lead to sudden heart death if left untreated. Heart failure can be divided into several stages. The first of these is stage A and includes individuals at a very high risk of developing heart failure, such as smokers, heavy drinkers, individuals with hyperthyroidism, chemo patients, and cocaine users. In this stage, lifestyle changes are detrimental. Stage B refers to a person who has a heart abnormality such as a myocardial infarction, left ventricular hypertrophy, or asymptomatic reduced ejection fraction, but has not yet experienced any signs or symptoms, which leaves them at a higher risk. The most effective way to identify them is to test for BNP. In stage C, the patient has reached clinical heart failure and begins to exhibit signs and symptoms of a heart failure that can either point to the left heart, such as cardiomegaly, gallop rhythm, and murmurs, or right heart, which causes dyspnea and crepitations due to its pulmonary involvement. Stage D is the final step in heart failure. It presents like stage C, but does not respond to treatment. At this point, significant damage has been inflicted on the heart muscle, and it enters heart death. The patient is now dependent on a heart transplant if there is any hope of recovery. Heart failure can lead to several complications. Renal failure is particularly prominent here, as it is caused by and contributes to heart failure. The renal system fails due to poor perfusion because of reduced cardiac output. The effect is exacerbated by treatments such as ACE1, ARBs, and diuretic treatments. Another complication is an electrolyte imbalance. Hypokalemia is caused by potassium-losing diuretics or hyperaldosteronism. Alternatively, drugs can also cause an increased renal absorption of potassium. Hyponatremia is a very large indication of renal failure and severe heart failure with a very poor prognosis. Patients can also experience a significant decrease in liver function due to venous congestion or poor perfusion. This leads to jaundice and a loss of liver proteins and products, such as clotting factors, making the regulation of coagulability problematic. Emboli feature in heart failure too. There are two main types: thromboembolisms, such as deep vein thrombosis and pulmonary embolisms brought on by immobility and decreased cardiac output, or systemic emboli, as sometimes seen in patients with fibrillations and flutters. Atrial and ventricular arrhythmias can be caused by electrolyte changes or the proarrhythmic effect of sympathetic stimulation. Atrial fibrillations appear in 20% of heart failure patients, whereas 50% of patients with heart failure die suddenly due to ventricular fibrillations. One of the aims of treatment of a patient in heart failure is symptomatic, to ensure the patient is more comfortable, These symptoms include massive edema caused by right heart failure and the ensuing venous congestion that could be remedied with diuretics and their decrease in renal fluid reabsorption. The true goal of treatment, however, is to decrease mortality. This is achieved through neurohormonal therapy such as ACE inhibitors, ARBs, beta blockers, aldosterone receptor antagonists, and vasodilators in an attempt to lower blood pressure and the strain on the heart muscle. Additionally, there are surgical interventions that can be taken to prevent further damage after heart failure has occurred. These include revascularization through vascular catheters, the insertion of pacemakers and endocardial defibrillators, and ultimately heart transplants. Finally, there are other steps to take in the treatment of heart failure. The main cause, such as the infarction or hypertension, should be treated. Precipitants to heart failure, such as hypothyroidism, should also be treated, along with comorbidities that place additional strain on the heart muscle, such as diabetes mellitus. Ultimately, the goal, however, is prevention, not cure. This can be done through the promotion of exercise, a healthy diet, the cessation of smoking, a decrease in alcohol consumption, and the limiting of stressful situations. The biannual checkup is key in early detection. And that is heart failure in a nutshell. Thank you for your time, and we hope that you learned something new. Remember to look after your heart, because it's the only one you got. See y'all on the flip side. Bye!